In this video, I want to talk to you about what is Achilles tendonitis. What is it? How do we get it? And most importantly, if we've got it, how do we get rid of it? Now, don't forget, if you do like our content and you find this information helpful, make sure you go and like this video, drop us a comment to let us know how you're finding it. But most importantly, subscribe and hit that bell notification. That way, I'll be able to keep you updated on whenever we release new content to this channel. So, Achilles tendonitis, well, what is it? What is the Achilles tendon? Well, the Achilles tendon is the tendon that runs down the back of our leg and attaches into our heel. Now, the thing that often surprises people about the Achilles tendon is actually how big is the Achilles tendon, because we can feel our Achilles tendon when we palpate that area just above our heel, and you'll know that perhaps that's your Achilles tendon, but actually the Achilles tendon runs quite far up your leg, probably covers the lower third of your leg. Now, the Achilles tendon, which comes down into here and attaching into the heel, has two main muscles attached to it, which as a group, as a collective name, we call the calf complex. But within the calf, we have our gastrocnemius and we have a deeper muscle called our soleus. And those muscles, when they contract, they create what we call plantar flexion. And this is where we look to push our foot down. So whenever our foot is moving downwards, the muscles at the back of the leg are contracting. Now, again, whenever we go into the opposite direction, which is when we flatten our foot, the muscles go into what's called dorsiflexion, the foot goes into what's called dorsiflexion. And this is where the calf complex is coming under tension because it's being stretched. So as a result of that, we know that the calf complex, the gastrocnemius and the soleus, are incredibly active when we are taking our foot through this either plantar flexion or dorsiflexion. So as a result, whenever we're walking or even at a higher load running, we know that these muscles are working very hard. So as a result, we can typically develop some dysfunction at the Achilles tendon. So how does Achilles tendonitis feel? Well, Achilles tendonitis most commonly presents its pain somewhere near the heel. This is its attachment point, so it's fixed point, and that's where if the muscles then pull, we might get the damage somewhere at the point where it's fixed. So typically that might be around the heel, and you might notice it becomes very difficult on load bearing activities like walking or running can become quite difficult as a result of Achilles tendonitis. So what do we need to do about this? Well, there's probably two things that in its most simplistic form we want to do. We want to make sure that the muscles in that complex are flexible enough and are stretched so that they're not putting excessive force through the area. And the other thing that we want to do, which is particularly important with tendon related issues, is that we're making sure that the tendon is strong enough to withstand the load that we're looking to put through. So if I break those things down, if you are somebody who you think is suffering with pain around the heel or you've been diagnosed with Achilles tendonitis, the first thing you want to do is you want to assess the amount of flexibility you've got at the ankle. And in order to do this, we typically use what we call a knee to wall test. And what we're looking for here is a test where you place your foot and you look to see how much movement you can get of the knee over the toe. And ultimately what we're looking to do is bring the toe further away from the wall and make our knee hit the wall without the heel lifting. And that's the important thing in this test, is that you're making sure that that heel is remaining flat on the floor. And we would typically want to see somewhere around 8 to 10 centimeters of being able to bring the toe away from the wall and keeping the heel flat on the floor. If you find that you're particularly tight in this area, or doing that test actually brings on pain or recreation of your symptoms, that's a good positive indication that you might be tight in this area. So how we want to correct this is through things like stretching. And again, I mentioned, and something that's often missed in Achilles tendonitis is that we've got two muscles that are attaching into that Achilles tendon. So as a result, what we want to be doing is making sure that we're stretching both. So you'll see here, I'm showing you stretches where we do one, the back leg is the leg being stretched. We need to make sure that heel remains on the floor as we drive that front leg forwards. But we do the stretch with both a straight leg, but then you'll see that we can also be repeating this stretch. And when we repeat this stretch, you want to do this with a bent leg at the back. And here what you're doing is differentiating between those two muscles. So you're then stretching out both the gastrocnemius and the soleus in order to make sure that both of them are going to have improvements in their flexibility, and both of them will be placing less stress upon the Achilles tendon. Once we're happy that the flexibility is good enough, what we want to then be doing is focusing on the strength. I mentioned earlier in the video that when it comes to tendons, it's very important that we're loading tendons as quickly as we can in order to restore them to be strong enough. And we typically do what we call eccentric loading here. And so there's a couple of ways that you might be able to do this. A classic exercise that we can look to use is something like the calf raise. So actually coming up onto our tiptoes and then slowly lowering ourselves down. So we're starting to increase that load through the area. If you then find that to be nice and easy, what you might want to be doing then is taking that onto a single leg calf raise where you'll be putting all of your body weight through that one leg. And I typically recommend that we're trying to do between 10 and 12 repetitions of this, perhaps across 3 sets. I should have said earlier that when we're doing our stretches, we want to be holding those for 30 seconds. Some other things that may be helpful for you in restoring your pre-pain state before Achilles tendonitis is some rolling techniques. And again, I particularly like using something like a lacrosse ball and placing the leg onto the lacrosse ball and finding those sore points. Once I find a sore point, what I then look to do is a technique that I call the pin and stretch technique, where we look to hold the ball in that position and then we stretch the tissue by bringing our toes up towards the shins in order to try and break down any of those adhesions that may be present in the area and causing a problem in the Achilles tendon. One final thing that may be helpful for you in terms of restoring full range and things and pain-free is to actually try something like a heel raise in your shoe, which might take some of the pressure away from the heel and also help you into this movement of dorsiflexion without actually creating so much pressure through the muscles. So I hope that's been helpful. As with any injury condition diagnosis, I would always recommend an actual assessment. This is really just giving you some generalized guidance to things that we see in the clinic. But having a detailed assessment will allow somebody to highlight for you where you may be restricted, where you may be weak, where you may be tight, and to build a personalized rehabilitation program for you. If that's been helpful, please do like this video. Drop me a comment though. Let me know some of the other tips that you found that's been helpful, or have you found that you've been struggling with Achilles tendonitis and how did you get over it? Or if there's anything we can do to help, please feel free to check out more information about us.